I want to talk a little bit about what ShadowNurse is. This is going to kind of feel like a sponsorship spot, but maybe that's okay. So just bear with me, and we'll keep it to 10 minutes. Since the next talk is like really super important, and we can always circle back on this, or I can do a video if that's important too. But we were talking about this last night. Like, what really is this kind of structure of what shadow nursing is? Like, what's the architecture of shadow nurse like, and how do you all play a role in it now or eventually? Um, and I think part of that is understanding really what we're trying to accomplish at face value. And what we're trying to tackle is this massive problem that traditional healthcare is really, really hard to navigate. And nurses understand that. It's We haven't spoken to a single nurse yet who doesn't understand where there could be a benefit in terms of just offering a helping hand to patients who are struggling along their journey. And so what we're trying to create is this experience for patients where we are the expert health journey navigator. Call it what you will. I mean, care navigator, patient navigator, healthcare navigator, health journey navigator. There's so many different ways to think about it. And we kind of like the more expansive version of the definition because we really want to feel like we can do anything we want to offer anything to the patient that we can do, like anything that's possible that can be done in giving advice or support or helping to empower a patient. We want to do that for them. And so that's kind of the spirit of shadow nursing. Is it all kind of originated with this notion that we're all doing this for our friends and family. I guarantee that every single one of you in the past month or so has had a friend or family member reach out to you and say, hey, I need help understanding something. Should I see a physician about this? I don't understand this word. I got this discharge summary and half it is in gibberish. I got a radiology report and don't understand what this could mean. I have a treadmill test tomorrow. What should I wear? I mean, the questions are all over the map. How important is it that I take this medication every day? And I'm sure you all have gotten questions like that, and I'm sure it's happened over and over again. And you're happy to answer those questions and be a support to that person because you know them, love them, etc. And there's no question in my mind that people that you've done that for have had a better health journey trajectory just by simply doing something that was seemed so obvious to you because of your training. And then because we're all doing that for our friends and family, what about everyone else, the 90% plus of people in this world who don't have someone like that in their friend group or in their family? And what's their health trajectory look like? And it's got to be something less than this, somewhere like this. So without somebody right there that you can pick up the phone and have a text conversation with, you're really alone. I mean, and so some of the imagery we use on our website, I think, tries to capture that in some of these darker kind of themes and stuff. And it's like this, we don't want people to risk their health journey alone. We want to give them options to feel like they are more connected, that they have an ally, that they have someone that they can relate to who's on the side of the fence that they're not on. And so if they're suffering from things like chronic illness, if they're seeing multiple clinicians, if they're in and out of hospitals, if they're confused and not understanding certain terminology, quite frankly, if they're just alone, if they're in a health crisis, all these reasons are prompts. If they got a new diagnosis, for example, we think of all these reasons as being prompts for someone to say, hey, I need help. And people just don't go to their physician for the kind of help that they need on a daily basis, particularly because when they came out of that physician's office, they probably only were retaining about 20% of the information. They don't even necessarily know what to ask questions about. And they certainly don't want to bother the clinic or have to go through the runaround of like trying to get certain documents that take forever to get. So this is where we come in, okay? And so this is where we are trying to essentially embed a registered nurse in every single family in America and ultimately the world. There's a huge need for this. Every family could benefit. There's not a single family that couldn't benefit from someone like this. Even in a, so then you're saying, like, well, you just said my family already benefits from me being in it. But I'll tell you this, when your mom or dad or sister or aunt or daughter or son is sick, you don't necessarily want to be the nurse. You don't want to be the one that everybody is looking towards. And in our testing, we had situations where that was the case. And we let those nurses and clinicians become family members again because there's another person there who's listening and they can trust to help manage what's going on. So you can be present for your dad or your mom or whomever, your husband, your wife, etc. So it doesn't matter that you're already a healthcare provider. In some cases, that's the biggest relief is when you can let that guard down and not be a healthcare provider. So every family can benefit from this. And our real vision overall is to have every family have a shadow nurse for life, starting at birth. Okay, and we talked a little bit about this in the hangout last night, but we now have our first patient who has been receiving shadow nursing since day zero, born in the hospital, shadow nurse, not at the side physically, but on the phone. And this is huge because that baby is going to grow up in a world where there's someone looking after them in a way that's never been done before, never been done before. And what will that do to healthcare? What will that child's trajectory look like compared to those who don't have it? And then how can we make every child born in America put that child in a situation where they have a shadow nurse too, and that family has a shadow nurse, so that 10 years from now, when that kid's 15, they're like, oh, my shadow nurse, Joni, uh, said this or that or the other thing. It's just a part of their life. It's just like Googling something or getting an Uber. They've grown up with a shadow nurse in their family, and the family is what matters because we were talking about this last night, and Amber brought up the really good point that we got to be in the community. If we're just trying to access information and help people at the nodes of healthcare, the traditional nodes, we're getting all the same information that everyone else is getting. And guess what? People's healthcare is kind of a drag right now with all the stuff we know about them. We still can't make things that much better. So we need to be going after what's happening in their community, in their home, at their place of work, with them all the time, on their phone. And so it's just like we want the relationship between the shadow nurse and the patient to be just like one is with you and your family members or your friends, where they can just pick up the phone and talk to you, and you don't have to answer right away. It could be asynchronous in a lot of ways. And so that really works wonderfully to do that. So we're going to run out of time in like 2 minutes, but I definitely wanted to give you that quick overview of sort of how we're positioning shadow nursing. And we've created this concept called interstitial healthcare. And so when I talk about the nodes of traditional healthcare, like the hospital, the clinic, the pharmacy, these are all nodes where you can generate and capture medical record information. But everything that's happening in between that, which is like 99.9% of somebody's life, isn't captured in the medical record. And that's where the important decisions are being made. And that's where the important influence can come in. And that's where you can really change somebody's life and put them on a trajectory that it's like we talk about this being similar to financial models, where if you start investing, early, it compounds in a way that you'll never be able to catch up to if you start investing even just a short time later. So it's all about capturing it early and often, and being there and helping change the trajectory of that person's health curve, similar to like their financial curve if somebody were to start investing early. I'll just say I'm going to take 1 or 2 more minutes to kind of give you an idea of how we're rolling this out. We are, and this really honestly just deserves a different format and a longer format for us to kind of talk in depth. And so maybe what we'll do is just record something like this and send it out in a newsletter where you have a full overview of everything that we're talking about. But we're really envisioning matching nurses, shadow nurses, to patients based on a number of attributes. We really want to try to, which is why we're being so selective right now and very, very, very picky early on about who we bring on. And we've said in our messaging that we're trying to be very selective, not based on like who has the best grades. That's not what we're looking at. We're looking at things like really down to the details of like experience in rural settings or experience in specific cultural groups, or things very specific to a region of the country, so that you might have familiarity with a specific hospital system or healthcare system within that area. So things like that are very intangible. You can't like just go on your resume and change these things. That's where we're at right now, and it's a small rollout. And so, but we have plans in the works to really blow things up big, and need you to be ready. And that doesn't mean you need to like quit your job or like commit to something full time or anything like that. But the way we're envisioning this is that there's going to be a role for you one way or another, whether it's 2 hours a week or 40 hours a week. There's going to be a need because we're building an ecosystem around shadow nursing that's going to be like a city, a city, right? So everyone's going to be doing slightly different things with slightly different people, but all helping each other in a big ecosystem. So trust me, there's enough work for everybody. We're not even close to having enough candidates to serve all the people in need. There's 70 million seniors in this country with chronic conditions. By, I think, to quote that correctly, it's probably by, I think, 2035, there'll be over 70 million seniors. They all need help, and we all can't do it alone. So we're also building technology to help us scale. And so I really want to get into all that stuff and talk about your role in that moving forward. It's really super exciting, but let's dedicate that to another session where we can get into it. Let's jump off. I don't want to be late for the next session, and I'm going to keep you late if I keep talking. So let's jump off now, and I'll see you there. Thank you.